So the technique that we're going to be demonstrating today is a muscle energy technique for an innominate that is anteriorly rotated and you want to do posterior rotation of it. So some general indications for the test you can find in palpation, your visual screening, or other general screening. When it comes to palpation, you would find that the ASIS on the affected side would be lower and more prominent. Meanwhile, the PSIS on that affected side would be higher and possibly less prominent. When you do other screening exams, like supine to long sit test, in supine you would find that the affected side that's anteriorly rotated is longer, and then when you have them sit up to do the long sit, that leg would actually become shorter. Another find is that during the first physiological posterior rotation of that innominate, they might have pain when they're side lying, but if you do repeated movements into posterior rotation, it might actually get improved or decrease that pain. And then you also might have limited hip flexion on that affected anterior rotated side. So when it comes to contraindications, some absolute contraindications would be acute musculoskeletal injury, any unset or unstable fractures, unstable or fused joints, patient refusal, any history of osteoporosis, metabolic bone disease or disorder, or if it's a site of infection and neoplasm. When it comes to relative contraindications, or just so precautions, these would include pregnancy, any kind of bleeding disorders, or general advanced age.
Alright, so we're going to do a muscle energy technique for an anteriorly rotated innominate. So I'm going to have my patient Angela lay down on her back, supine position. I'm going to flex her knee and her hip of the affected side. I'm going to rest it on my shoulder. I'm going to stabilize the contralateral limb. I'm going to ask her to provide an isometric contraction. We're going to hold it for about 5 seconds into hip extension because this is going to engage the hip extensors. So go ahead, Angela, push into my shoulder. Good. 1, 2, 3, 4, 5. I'm going to engage the barrier and go push her into more hip flexion. And I'm going to ask her to do the same thing again. 1, 2, 3, 4, 5. And one more time. Good. 1, 2, 3, 4. Alright, so the test for the effectiveness of this treatment, we want to assess for symmetry at the ASIS by checking for decreased anterior rotation, or we could also do a supine to long sit test by assessing for symmetry at the medial malleoli.